herbal medications because if you see it there, usually it's difficult to tell or quantify whatever the constituents are
Okay.
or what's in it.
Okay.
So it's something that we want to encourage you to
Okay.
do
Okay.
for the benefit of your heart. It would be best if you actually rather go with either your lifestyle modifications or the medications prescribed by a health service provider or by your doctor.
And you should also realize that, there are approved, tested, scientifically, verified herbal drugs for certain things. And now most hospitals have herbal medicine practitioners.
Yes.
And if you are thinking that you don't like the pills and you want to talk, see a herbal medicine practitioner. And usually they're able to tell you the truth. I know what for this particular one, I think you should take the tablet.
That's true.
But if you follow advertisement, when it comes to your heart, if you follow advertisement, only God knows what will happen. Dr. Eminem points out, someone wants to know that I hear aspirin is very helpful. Can I take it without a prescription every day? Because I hear it prevents heart attacks.
The knowledge about aspirin and heart attack and all of those things, the knowledge keeps changing. So because we discover new things all the time. Previously, people were given aspirin all the time to prevent issues, but now we reserved aspirin for people who have issues. So we use that as a secondary prophylaxis most of the time. So if your blood pressure is just high and there are no other issues, you just take your blood pressure medications without any aspirin. But if your doctor has seen something, let's say your blood pressure is high, you also have some blockade in your blood vessels, and your doctor would want to add aspirin to it. That would be helpful because of the additional issue, a secondary problem that has occurred because of the hypertension. But if it's just a simple problem without any issues, chances are that your doctor won't ask you to take aspirin. So you wouldn't routinely buy aspirin because you want to have good cardiovascular health.
Okay.
You want to prevent problems, so you want to take aspirin. No, we only give it to people who have had issues in the past, like had a stroke, heart attack, or other things that will make us think that there will be the need for the person to be on aspirin.
Okay, so it's not like because you have heard that aspirin is good, you just go into the pharmacy and say, I'm buying aspirin.
Yeah.
Okay, all right. So that answers your question there. Same person, good morning to you, Kwame. Same person comes back and is asking about heart supplements. It was just recently that I think I should pay attention more when I walk into pharmacies. I think I should pay attention when I walk into pharmacies. It was just when I walked into the pharmacy and I realized that there's so many supplements on the shelf, especially for cardiac stuff. I don't know if you it's so many. I was like, wow, all this. So he's asking about heart supplements.
So supplements are supplements. So that's how they are.
I like
so
that.
Really,
supplements are supplements.
Yeah. So it's something if you want to add on, and that supplement it's FDA approved, and you want to take, that is fine. But it's not something we encourage. What we encourage is the screening and lifestyle modifications generally. And then if you have blood pressure or any other issue, take the medications that have been prescribed by the doctor. However, if somebody is on a supplement and is FDA approved and comes to me, I won't tell the person to stop. But it's not something I'm going to prescribe for somebody to take. Rather, the person should focus on lifestyle modification, exercising 30 minutes a day. That's about 150 minutes in a week. If you break it down, at least 5 times 30 minutes every day, you should exercise. Or taking brisk walking, cutting down on alcohol, stopping smoking, and all those things. There are those things that have been shown to help with cardiovascular health, not supplements per se. Although certain things that can may be found in the supplements, like certain oils, like fish oil and all of that, have been shown to decrease cardiovascular risk and all of that. It's not something we routinely prescribe, but if you would want to be on it, that is okay. But at least you should sort out the basic things, the lifestyle modification, taking your medication before you think about supplements.
Dr. Sarah, what about weight gain? Does gaining weight or losing weight affect your blood pressure?
Yes. So would rather prefer you'd lose weight, not rather like gain weight, because if you are obese, your risk of cardiovascular issues go up.
Okay.
You are prone to more cardiovascular events. So yes, in terms of weight gain and weight loss, rather prefer that you don't have, you're not obese, but you rather lose weight and then you're in check.
I think we should be checking BMIs in hospitals. So.
That's true.
I think we should be checking BMIs in hospitals. We don't even check height. We just check BP, and then we say I think we should be checking BMIs in hospitals. I just think we should be checking BMIs in hospitals. If you have a text, you can send it in on 05939329993. 05939329993. That's the WhatsApp line. We'll open the phone line shortly, and then you can call in, and you can also ask your questions. Dr. Aminu, someone wants to know, is hypertension curable? Like, can you cure hypertension? So that's any hobby.
Okay, so it's also another controversial area. So for hypertension, we actually have two types of hypertension. We have essential hypertension, also known as the primary hypertension, secondary hypertension. So the primary one is a hypertension that really doesn't have an underlying problem. Usually as we age, naturally, our blood vessels become thicker than usual, and our blood pressure starts going up. So from 35, most of the time, that is a natural, in quotes, natural thing that may happen at a point in time. Our blood pressure may go up. So that type of hypertension, the only way to manage it is with, one, the lifestyle modifications, and at times with blood pressure drugs, if your doctor thinks that you really need the blood pressure drugs. And there's no cure for that hypertension, but it can be well managed. Once your medications, it's fine. Occasionally, somebody may be on, may have very high blood pressure. You put a person on medications, maybe let's say 3 medications. With time, blood pressure is normalized. You need to take some off, and you take off until a person is on 1. And at times, you may just need to put a person on very small, maintenance dose. Very occasionally, somebody on antihypertensives, your doctor may want to take it off and observe, especially if your blood pressure is constantly going down, it's causing issues. So it's just only in a few people that will have them taken out of blood pressure medications. But most of the time, you need blood pressure medications to control your blood pressure.
It's a difficult conversation for people to know that they're going to be on medications for the rest of their lives.
Yeah, so maybe we can look at it in another context, like the same way we eat to survive. Probably we can just assume that this one too is a necessity that we need to take to also survive, and add it to our routine life, and then consider that as something that we need to survive. Like the way we have to eat to survive, we have to drink water to survive. We also need to get our blood pressure under control to also survive. If you are lucky and your blood pressure is probably secondary hypertension, and that one, the cause, secondary means that something else is causing it.
Yeah.
If at times we find a cause, and then that cause is taken off for another thing that is causing your blood pressure to go up, and your doctor is able to get rid of the need for that drug, and you are no longer on that drug, then probably you may, in that case, you would have, in quotes, achieved cure. But most of the time, blood pressure is hypertension, is essential hypertension. In that case, there is not going to be any cure. So we just have to have it as something that we need to appreciate and deal with it, and manage it well and move on.
Adams, good morning to you. Adams is asking that, Doc, I've been told that salt and seasoning all contribute to high blood pressures. consume food. How much salt is too much salt? I was gonna say, how much salt is too much salt?
So I mean, well, as he said, when you take in salt, your blood pressure can go up because I mean now there's retention of water, and then your blood pressure can go up. So, in terms of when we are advising you the diet changes, we advise you that you have to go in for low salt diet. I mean low salt diet.
Low salt diet.
Yes.
Please, which one is that one too?
So
low salt diet.
Yes. So
Okay.
you don't take in a lot of the salt, basically.
Okay.
Yes. You have to have your salt under control.
Okay.
Yes. So you may not end up getting the diet that you have a lot of salt to taste. You know, you want the thing to be a bit salty and then have.
Sometimes, Charlie, is a
I
salt
know,
that.
I know.
Yeah, you know.
It all contributes to the taste.
You know.
You have your fries and you
have your
to
fries.
sprinkle some sauce on it. I guess it's all fat, but then in such an instance now you have to get it under control.
Now that I have to enjoy all the good things in life, people have to stop eating this and that. So a low salt diet is as little salt as possible.
Yes,
possibly.
To make the food, if I should say eatable, but but not something that you feel like really there's salt in this food. Anytime you are eating and you realize that there's salt in this food, then it means that there's too much salt in the food. So don't add any additional salt. Some people will have salt on the table. Go to a restaurant, there's salt on the table, so that you can add on additional salt. Those additional salt, most of the time, is excess salt. So that is, and the other things like momone, for instance, is salted. So once so once you have momone in your diet, you shouldn't add additional salt to it, and just try and balance it so that at times just the momone salt alone will be enough for the entire meal, and you don't need to add any additional salt.
So all ye momone eaters. Okay, so if you have momone, which is salted fish, or if you have tilapia, it's enough. Don't add salt again.
Yes, additional salt to it.
Okay, so King is listening to us from Odium. King is asking that the smart watches that can check BPs and SpO2 and all that. He's asking if they are reliable. You guys have a smartwatch.
Validated.
Yes.
So you just have to make sure that what you're buying has been validated.
Okay.
So some of them. So you just have to read on the brand that you are using and try and get the publications on it so that you can verify for yourself whether really it works and whether it's been validated by the FDA to check blood pressure.
Okay, so some of the watches have been properly validated.
Yes.
That whatever they are checking is reliable.
Yes.
Charlie, so don't just buy the thing because they are selling it in Edumo. And it looks nice, but it's probably not doing what it's supposed to do. Because I think that if it is properly validated, then I think it's very reliable. So I didn't wear mine. I was in a rush, but it does a good job of checking, everything for me. So, yeah. But checking your blood pressure, people, it's extremely important. If you run an office, if you run a business, a church, a school, just buy a properly validated SFIG. Get somebody trained and just check the blood pressures of people. Allow people to be able to walk in to just check their blood pressures, and it will surprise you. Anyway, let me open the phone lines now. 0541 022318, 0541 022318. That's the number to call us on this morning, and you can call and ask your question or clear up something. You may have heard something that you're not really sure about, and you just want to make sure that what you heard is right, and that nobody's trying to hoodwink you. So 0541 022318. You can call us on the show this morning, and then you can ask the questions that you want to ask. Someone wants to find out that he said that strokes are becoming really common now, and his main question is that, okay, let me pick this call and then we will get back to that. Hello, good morning. Okay, I think I have a problem with the phone. Can you repeat your question, please?
Of high blood pressure, but we haven't heard of low blood pressure.
Okay.
So
Okay.
let's elaborate on it for we to know what to do.
Okay. All right. Yeah, I think it's a valid question. People have that concern. They hear about high blood pressure, but we don't hear about low blood pressure. Because there are some people who come and then you check their blood pressure and you're wondering if everything is okay. Like it's pretty low. Okay, so he's saying that there is low blood pressure, but we don't hear enough about it. Is that a thing or internal medicine for what say you?
So, if your blood pressure is low, it's good. It's good for your blood pressure to be low, unless there are issues. Let's say diarrhea and vomiting, you've lost a lot of water in you, and now your blood pressure is low. Then it becomes a problem. Other than that, if your usual blood pressure is, let's say, 80, 50, and that has been the blood pressure you always record, and you don't feel dizzy, you are okay going about your usual lifestyle, then that is not a problem. So in that case, nobody will tell you that, oh, your blood pressure is low, so go and take a lot of salts and bring it up. You don't need to bring that up. It's only a problem when you are symptomatic. That's the term that we use. When you are having issues because your blood pressure is low. Other than that, it's not a problem. Or let's say if you're on medications and your blood pressure has now come very low, your doctor will want to take some out. Other than that, if your usual status, your blood pressure is always low and you don't have any problem, then we don't worry about it.
Okay. So 0541 022 That's the number to call if you've got any question to ask us this morning about hypertension, you've got any question to ask us about blood pressures, your cholesterol level, which is something that we should all pay attention to. I think someone sent a message to me earlier. Sorry, I forgot to read it. Good morning to you, Labi. What he's saying is that okay, Labi. Okay, this call is gone. So 0541 So what Labi was saying was that it's quite challenging to change your diet, especially when they say you are hypertensive. Saying that there are several diets that he has seen on the internet, which he's wondering if it's something that he should try. But a lot of the diets that we plan for our patients are very foreign. Saying, are there?
So the diets, I mean, we encourage the fruits and then the vegetables, and then the portion control. But we also have professionals. I mean, he said that he's been seeing a lot on the internet, but we have professionals that if you talk to them, they can give you a very good diet plan depending on your BMI. They'll check your height, they'll check your weight, and then they'll talk to you and then know what you eat daily and then what you have available to you. And then with that, they'll draw a very good diet plan for you. So if you come to CAF or Confanacho, for instance, and you visit the diet unit, they can give you a very good diet plan. But then here, I'll just tell you that we encourage that you take in more of your fruits, more of your vegetables, and then this can help control, can help with your diet changes or your diet modifications.
Okay, so I don't think that, like you're saying, it's not something that you should do on your own.
No.
Don't. I don't say Google, but don't Google. Don't just Google it and say, "Oh, I've seen this diet." Because yes, he's right. Usually, when you look at those diets, it's very foreign. It's not local. There's a lot of funny stuff on there.
Yeah.
That's things that you can't find on our local market. All this kiwi and dragon fruit and beetroot and all those funny things that you can't find on our local market. If you're in Kumasi, literally every Ghana Health Service facility has a nutritionist or a dietitian. If you want to go to Konfanochi, they have a very, very well-structured unit there, the nutrition unit or a diet unit. Let me pick this call. Hello, good morning.
Hello, good morning, doctor.
Yes. Your name and where you're calling from, please.
I'm calling from Abuakwa.
You're calling from Abuakwa. Okay, kindly go ahead.
Okay, at that day I check my pressure. I see my BP come 94 and the blood come 70 and my pulse too come 120. Then I make weak. Immediately I take fiber food and small protein. Even time I see all feel good. So I come well. So like that place, it make me something. So I want to know.
Okay.
Maybe you go explain to me.
All right. Thank you very much.
Okay.
So he had an acute episode, low BP, 94, 70 something, but he ate something and he says he felt better. Is that what he should have done?
Well, he should have at least visited the hospital. But for the fact that his blood pressure was low and his pulse was high and he was feeling weak, that is symptomatic. So that you have issues related to your blood pressure that is low. So in that case, hospital. And I'm sure what he did to help. Eating, taking water can also bring the blood pressure up when it's low. I don't know what preceded this event. Probably had some maybe diarrhea and vomiting or something that caused him to be dehydrated. That can bring the blood pressure low and can cause symptoms. Once it's symptomatic, there are symptoms related to low blood pressure, then in that case, the doctor would have to take an action. Other than that, low blood pressure is not a problem.
It's not a problem. Okay, so could you also send a message to me earlier? He was saying that he's blacked out once whilst in the toilet. He said he just blacked out, and then he regained consciousness. Then he went to hospital and they said it's possible that his blood pressure went up during that time. But he's since then been checking his blood pressure every day and he's fine. Now his worry is that now he can't go to the washroom without telling somebody because he's not sure what will happen.
Okay, so what happened?
At least I'm sitting here laughing.
So what happened to him is called syncope, syncopal attack. It's an episode of loss of consciousness. And I haven't seen him, I haven't examined him, so I can't say much as to what could be the cause. But there's something called situational syncope, where when you are doing something, the situation like we are visiting the toilet or you're urinating and those things, because of the changes that occur in your body, some nervous activity that occurs, some vagal stimulation, especially when you're straining and all of that, at times it's possible that can make you pass out. But for him, I think he has to be evaluated well so that we'll be sure about his heart. We'll be sure he doesn't have any heart issue that can lead to that loss of consciousness. But syncope can happen without necessarily occurring again. It may happen just once in your life and it may never occur again. So you shouldn't be so afraid. And you should also make sure that his stools are soft so that he wouldn't need to strain too much in the washroom. So taking lots of fruits, vegetables, a lot of water, exercising may make your stools soft and you don't have to strain a lot. That can cause loss of consciousness. But I think he has to be evaluated. And if he's been evaluated and doctors didn't find anything, then he should be reassured that it may not be anything that may occur again. It can occur again, but it can occur again.
Hey, I guess it's challenge. 0541 022 318 0541 022 318. 8. Yes, Johnson, you sent a message earlier. Listen, if you support teams like Manchester United, yes, your blood pressure will go up. Well, that's on a lighter note. What he's saying is that anytime his team is playing, his blood pressure goes up. So don't watch. Don't watch. Okay. Yes. Or change teams to support a better team like Chelsea. Your blood pressure will always be your blood pressure will always be, in the normal range, because we're definitely going to win. But I mean, that there are things that trigger people, and sometimes we take it for granted. Oh, Black Stars are playing, that is why my blood pressure has gone up. But should people really take those things lightly?
So, as he said it earlier, that in an acute event or when you have a stressor, your blood pressure can go up. But if this stressor is taken away, that's in terms of maybe after the match, it's not up.
So maybe after the match, Charlie, like you are pained, like you are pained.
Yes, but acutely, right after that, and then everything settles and your blood pressure comes back to normal, then it's not so worrying, because it's just the body regulation. So it's not something I don't think you should dwell too much on.
Okay. Good morning to you, Janet. Janet is saying that her mother used to black out a lot. Her mom is in her 70s and used to black out a lot. But when we go to hospital, all the tests will come back as normal. A doctor advised her to take what she's saying is what? Okay, a doctor advised her to take a very low dose of an antihypertensive, and that seems to be helping. Says we haven't gone back. Hey, you're right. Says that we haven't gone back for review since. Are there instances where, for some reason, I mean, it's you guys who know, you put the patient on an antihypertensive, but it's very low, and I don't know how long are they supposed to take that for.
So the reviews are important, so the doctor would at every point in time decide on the indication of the drug. Is it still indicated? Do I need to change the dose? Do I need to modify anything about it and all of that? So I'll then treat them to go back to the hospital for review. Reviews are important because you need to decide on the way forward at every point in time. This whole thing is a continuous process. Not like you're hypertensive and given drugs forever.
So forever, that's what you're going to take.
So they are told in chair, sign no to be, baby. You should go and get reviews.
No, but I think that's one thing that you guys should also be. I know the pharmacy people will fight me, but I mean, when people show up at the pharmacy with empty boxes of medication without a prescription, I think they should be hesitant to serve it. I think they should be hesitant to serve it.
But I think it's also quite difficult in some instances, in some situations.
Because they don't want the money to work to it.
I mean, that's one part of it. And then, I mean, secondly, I could say maybe the person visited the hospital, had a prescription, all right, but then along the line, ran out of medications at that point, and then the review date isn't up then. So ideally, the person should visit the hospital and then inform the service provider or the doctor that this is the situation. But I mean, we will prefer that at least you are covered till your review. Yes. So I mean, it's very difficult to actually give one answer that's no, I'm not going to serve this medication.
Okay, so then just a follow-up. Cynthia is asking that, she's saying that she's been taking atorvastatin for elevated cholesterol for like a year now. She's saying that, when can I stop? People just don't like taking medication now and then.
Medication taking is difficult. I mean, for everybody, it's
for everybody. Me, I'm a number one culprit.
It's difficult.
But yet again, with this instance, she's supposed to go for a review. She was put on it by the doctor, and then whatever the indication may be, currently we don't know what the indication is. Whatever the indication may be, it will be checked, and then there will be a decision that will be taken. So she has to go for her reviews, and then the decision will be taken.
Okay. So you have to go for a review.
Yes.
Please go for a review. Don't decide on your own that you're going to either continue the medication or discontinue the medication without a review. But so let's say the person goes back and now the cholesterol is within normal limits. Are you going to stop the medication? Or are you going to put a person on a maintenance dose or something?
Yeah. So
Because usually, see, that's our aim. I know people that have come and their cholesterol is through the roof, and then they go back and they go and work on it really hard. Then they come back and the cholesterol is like normal, and they're like, "Intedonunjai."
It's more of a case by case basis.
Yeah.
So we look at cholesterol, and we also look at your risk. We assess your cardiovascular risk. So there's a score that we use based on your age, based on your whether you have hypertension, diabetes, and other things, and put you in a certain risk at a certain risk level. So if your risk is very high, even though your cholesterol may come down, your doctor will still would want you to continue the cholesterol drug, probably at a different dose. And by that time, for some people, for example, people who've had, let's say, stroke in the past, you would always need to be on cholesterol drugs, even if your cholesterol level comes back to normal, until a certain limit where your doctor would want to change. So everybody, there will be a target that you need to achieve. So you just won't look at your total cholesterol, it's less than 5.2, so that is it. No. Based on your risk, your doctor may even decide that I want your LDL to come to less than 1.7. So even if your LDL, your total cholesterol is, let's say, 3, LDL is 9, your doctor will still would want to put you on the cholesterol medication. So it depends on why your doctor decided to start and where you've reached. So the review will try and sort those things about. Some people may forever require cholesterol drugs, and some people adjustments may be made along the line.
Time flies when we are learning something. We're just a few minutes shy of 10 a.m. here on 107.9 Orange FM, Kumasi's music leader, on the Orange Health Lounge. So before you guys go, any final words? Let me start with my Absunian. That's what I've been doing the listening and all the comments you've been sending. I hope you change. Well, so before we step out of the studio, any last words for our listeners?
So I would say you have to prioritize your health as one, and then keep the heart in mind. You have to take note of it. You have to treat it with care, and then also the things you said over here. You have to prioritize your reviews with medications. You have to make sure you adhere to your medications. So I think that's something I can leave it for the listeners.
All right.